Hi everyone. So we are today with Luis Bosch.
Very good.
So he's a European and American specialist in emergency and critical care. And I was listening to one of his presentations about respiratory distress in cats, and there was something that was really interesting about tracheal tear. So I wanted to ask him a few questions because it has only happened to one of my colleagues once, and then we were kind of a little bit discussing about it. When we do a spinal tap in a cat, we will be flexing the neck. And once I had a colleague that, because of the cuff wasn't deflated, this cat had a tracheal tear. So I was asking him if he had seen that in dogs, because in dogs usually I don't deflate the cuff, I just keep it for CSF tap. For the cats, I will deflate it because I was a little bit concerned about what happened. And so, what have been the situations where you've seen a tracheal tear in a cat?
So definitely not in that scenario that you described. So there was a learning point for me today. Very, very interesting. I think something that probably I haven't thought about that. But just because the most common scenarios for us are cats that usually go for just routine surgeries, just like castrations or space or dental procedures or something like this that seems to be very easy. And most of the time, one of the problems that I have seen is that cats get intubated with a guide wire that is metallic, and that usually protrudes through the tube.
It's longer than the tube.
It's longer than the tube, and people don't really care about that. And that tip of the guide wire usually tears the trachea. I have seen that as well with excessive cuff pressure, moving patients with an anesthetic machine connected to the endotracheal tube. I have seen that in cats with long-term mechanical ventilation where the cuff has not been deflated or during the days, no, and you can harm the trachea if you leave the pressure on the trachea for longer than for more than 4 hours.
More than 4 hours.
Yeah, we usually go with 4 hours, 6 the most, deflating and inflating again the cuff.
So you deflated it, for how long would you leave it deflated?
Well, that's a good question because we don't have rules for that. So you deflate the cuff, you move a little bit the tube, looking for another position of the cuff. Sorry, because we know that if the pressure goes higher than 25 millimeters of mercury, then the necrosis could happen because of the vascular compromise. No?
Okay. And you obviously will make sure that you only inflate it until there is no leakage. So you don't overinflate it. So you always need to be listening. How much do you need to inflate? And what will be the clinical presentation? I'm particularly thinking about neurology, that and the CSF tap, and what will be the typical clinical presentation of a cat? Imagine that if we had a tracheal tear, we're waking up from CSF, you're letting him recovering in his kennel for a couple of hours. Would you see anything 2 hours later before you send this cat home?
Yeah, I mean, it depends on how much trachea was lacerated, if it was just a puncture, or if it's a big lesion. Sometimes if the lesion is really big, then all of a sudden you see a cat with subcutaneous emphysema, you see pneumothorax, you see pneumomediastinal mixed rays, and sometimes because of the pneumothorax you have problems to ventilate the cat. So if that happens and it's really bad,
before waking up you already see that you have difficulties of expanding the chest.
Yeah, you will see that problem if the laceration is as bad. But just because you have them intubated most of the time, if the damage is not so much, then it goes unnoticed until you wake up the cat. And many times it starts with a cat that has just mild subcutaneous emphysema, so it can go home and get absolutely unnoticed, and then the owner comes back and that's what he notices, that the cat is inflated, has like this bubble paper feeling.
Like the bubble wrap.
Exactly, that's
it's a nice noise.
And in the worst case scenarios, what you see or what you get through the drone emergency is that cat that is just breathing really, really bad.
Yeah. Okay. So emphysema will be a good one.
Mm.
So you were saying that if the cat is stable, there's no respiratory distress, and clinically, so first of all, clinically it's not getting worse, and also in imaging, so what you see on imaging regarding the pneumothorax or the mediastinum is not getting worse. You could be waiting, and it could take up to 2 weeks for that tear to improve. However, if the cat is clinically progressing or radiologically progressing, you need to do something.
Then you need to do something about that. Yeah.
And I think that was quite interesting, important that you follow with imaging, because if you have a cat that is stable clinically, but the images are progressing. So how often would you say repeating chest x-rays?
We are doing it, and because of what I have experienced in my life, every 24 hours we make an X-ray, unless the cat gets worse. If he's clinically getting worse, you already have the answer. So so you know the imaging is gonna be worse. But sometimes I have had those cats with a clinical presentation that they are eating, they are feeling well, they have no problems, but radiologically they have been getting worse and worse. So that's like a red flag that you have to do something.
You need to do
about
something before they are in respiratory distress. Thank you very much.
You're very welcome.
I hope that was helpful. It was very helpful for me. So yeah, thank you.
Thank you. Bye-bye.
Bye.